Hey, folks. I know that it is late, so we'll see what happens, and I'll wait a second for folks to get in here and for y'all to share and let folks know. And I want to recap for a little bit because I had Hawkins County last night, did not go live as a result, and so haven't been live since a lot of stuff has happened. So I wanted to do that now because I've got a lot going on the next little bit in the week, and so I wanted to just recap, reset, and then kind of let you guys know some of the things that I'm thinking about. Hey Herb, how are you? Some of the things that I'm thinking about, what's crossing my mind, what's next, what are my concerns, what are the things that I'm very optimistic about, those types of things. Hey Travis, how are you? Hey Gail, hey Terry, hey Dante, hey Kayla, how is everybody? Hey Randy. So yeah, so I know that it's extremely late, and if you think it's late, try being me. Thank you, Kaylin. Hey Sherry. Hey Crystal, how are you, honey? So, hey, Emmanuel, how are you? Hey, Michelle. Okay, so now that everybody's had a chance, hey, Martha, that everybody's had a chance to kind of get in here. Doris, I did get your message. I was in Lee County tonight, so I will respond back to you shortly. I will definitely do that. Christy, you're welcome. Hey, Kim, how are you? Hey, Debbie. Okay, so, hey, Randy, I need an email address to send that information to that you asked me about. Okay. Amy, I am feeling better than I was yesterday. Definitely. I'm still not all the way 100%, but better than I was yesterday. Definitely. So, okay. So I want to go ahead and jump in here and kind of talk about this stuff and give you my take on a lot of stuff that's happened lately. Hey, Michelle. So let's just start with yummy goodness. Can we just start with yummy goodness? Because Hawkins County was yummy goodness. Was super excited about everything that happened with Hawkins County. So first of all, we said that Ballad did not come to Hawkins County, and that's true and not true at the same time. So Ballad did have a representative there. Andy Hall was there. He was in attendance. They just chose not to present. They chose not to speak. They chose to just listen and watch and all that kind of stuff. So that's what Andy Hall was there, and that's what he did. He listened. We saw him texting. They chose not to speak. They chose not to present, and that was fine with me because they gave us their time. So we got a chance to really be thorough. And that's what I was really excited about. So I was excited about the opportunity to not just talk about the trauma centers and the NICU, but to also talk about Allendale and the Cancer Treatment Center, to also talk about the COPA, what it really means, what can be done, what can't be done. And, I have to give, a lot of props to John Metz and the chairman of the commission and all 21 of the commissioners who gave us the opportunity to share that information with them, with their residents, with their constituents. It was a really great forum to be able to share information. So kudos to them for giving us. I think that's like one of the most welcoming platforms that we've been in that said, hey, we need answers. And even when things came up, they allowed us to elaborate and to explain some additional things. So that was really great. I really feel like folks who attended or who watched that live got information that maybe they did not have previously, which was really great. I do plan to do like a series of videos where I kind of talk a little bit about where we are, like what's the COPA, what does it mean, what are the options, because there's been a lot of questions about, well, what's next, you know what I mean? So I do want to speak to that a little bit because I have been thinking about that and what it means. Yeah, Terry, all 21. We did get all of the resolutions that they passed last night were unanimous, 21-0. And it was in opposition of downgrading the Holston Valley Trauma Center from a level 1 to a level 3. It was opposing downgrading Bristol Regional Medical Center from a level 2 to a level 3. It was also opposing the downgrading of the Holston Valley NICU from a level 3 to just a well baby. So basically closing the NICU. And it was also against moving the cancer treatment center or the infusion therapy center that is currently located at Allendale to a building that is on the Indian Path campus. Now, I want to say something about this because people are talking about, the fact that, there was a question about the lease in Allendale and all of those sorts of things. That facility, Allendale, is not owned by Ballad Health. They do lease it, right? And they have said, oh, we want to get out of this lease, right? But primarily, the purpose for moving is to get that 340B pricing, which in and of itself isn't a bad thing, right? No one is against it. No one is against, or at least I'm not against, Ballad Health getting 340B pricing so that they can get their materials and their medications at a discounted rate. I'm not upset about that. That doesn't bother me. What I have issue with is the additional facility fees that patients are going to be charged, the mandatory upfront costs for radiology, PET scans, CAT scans, things that people need. That's the part that I have objection to. If you want to move the facility and waive those fees for your patients and keep it the same, you'll get my blessing, right? but that's the part of it that I'm not on board with. And there's definitely, how I agree, there's still a lot more work to do. And this is what I want you all to understand. These resolutions are great, okay? Because what they do is it says to the state of Tennessee, hey, listen, we, the commissioners, we, the Board of Supervisors, recognize that this is really bad for our people. And we are passing these resolutions because we want it on the record. We want it, as a matter of public record, that we oppose these changes. And what that does is it puts more pressure on the state, who is tasked with overseeing this COPA and holding Ballad accountable. It makes them pay attention, because obviously you don't pass these resolutions if you don't think that it's bad for your constituents. So that's the purpose of these resolutions. It puts pressure on Ballad Health to examine the choices that they're making, and it puts pressure on the Tennessee Health Department to assess and oversee and really take a look at these changes that Ballad is proposing. Okay, so that's the reason. These are big wins. And at the same time, they're small battles in the war that we're kind of in the middle of, right? And so, I've begun to really think about what is the long term, like what's the goal? What do we want, right? And I've talked about this just a little bit in the beginning of this, like what do we want long term? Do you want to get rid of the COPA entirely? Do you want to leave the COPA in place, but then but modify it so there has to be something different? These are some things that people really need to start thinking about right now, because you have to understand that if we eliminate the COPA, if we terminate the COPA, if we prove enough to the state of Tennessee and Virginia, in the Commonwealth of Virginia, and they say, hey, modifying it doesn't work, because there's a process. First, they modify it. And if modification doesn't work, then you look at termination. Now, when you look at terminating the COPA, what happens is the existing COPA actually stays in place while they develop a plan of separation. Okay, okay, so listen, let me finish, guys. You're talking about what you want. I want you to make informed choices about what you want. Because here's the thing, we have to understand that this is a little bit different. Okay, I need y'all to understand something, because here's what we've done. We've taken 2 eggs, cracked them open, scrambled them up together, and they're in a pan. So when you start to separate this thing, guys, when you start to separate this thing, it is messy. It is messy. Things have been picked apart. Things have been shut down. Equipment has been moved. Money has been put together. It's a big, fat, ugly mess, okay? So what has to happen is when this COPA, if this COPA is terminated, then what has to happen is the existing COPA stays in place, the oversight stays in place, while Ballad Health comes up with a plan of separation. And that plan of separation has to be very detailed. They have to say what they're going to do, how they're going to do it, and while it happens, the existing oversight stays in place. Okay, guys, I need you to stay with me and listen for a second, because I really want you all to start thinking about this. Because listen, prior to this, let's just say, let's go back to Mountain States and Wellmont. Let's do that. I need you to understand that when you get Wellmont back, it's not going to be the same Wellmont that you had. It's not. So take that right now and know that that's a reality. You are never going to get back what you had, because what you had no longer exists. It is different. So even if you get Wellmont as its name back, it is going to be different. Come on now. Come on, let's all be grown-ups for a second. Okay? Now, when you get it back, prior to this merger, Wellmont had 8 offers on the table. I don't know if they're going to be able to get those 8 offers back or not. I don't know who those offers were from or what it looks like. Same thing goes with Misha, right? They are not going to be the same. It's going to be very different. So, you know, for me, yeah, well, the monopoly as we know it in terms of when an entity would be broken, and technically they would go back to being competitors, right? Technically. But the question would be, how does that work? Whose doctors goes with who? Whose equipment goes with who? Like, that's what that plan of separation would have to entail, and a whole lot more. So let me just say this to you all so that you understand. This is going to be a long process. That's my phone telling me I should be going to bed if I want to get 6 hours of sleep, which I never do. But this is what I need you all to start to understand, is that you are in for a long haul no matter what. There are lots of options, right? That we would have lots of options. And while all of those options are explored, then the existing COPA would stay in place, but there would be no more fulfilling of those commitments, right? So we would keep it in place, like hold everything down while we figured out how this is going to be separated. Like, that's the plan of separation that would have to take place. So I want you all to really start to kind of think about that when we think about, okay, so what's going to be happening down the road? Because I don't really know. You know, someone else said to me, you know, well, what if Ballad stays Ballad? But with that, you get rid of, you know, all the CEOs. You get rid of, you know, Alan Levine. You get rid of Tony Keck. You get rid of Lisa Carter. You get rid of Lisa Smithgall. You get rid of Monty McLaren. You get rid of whoever. Like, there's a bunch of people that you would get rid of. And then you would also get rid of several of the board members, right? So, you know, we would want people who are conflicts of interest, or people who are, you know, basically in bed for different reasons, right? Then, you know, you might get rid of, like, Eastman would have to go. I would want to see a hospital board where you have at least, you know, 30 or 40% of the board, preferably 40% of the board, be actual physicians. Somebody, you know, physicians and nurses. I would love to see physicians and nurses, or nurse practitioners on the board. Right? I would love to see people in those positions. You know, would it work if we got rid of some of the people that are in leadership that have proven to us that they don't have the community in their best interest? And then if we had independent oversight that didn't belong to Ballad, you know, that was a little bit different, you know, it would still be a labor monopoly. I get it, Terry, right? I get that part, right? So there's pros and cons. And so maybe that's the first step, is to take a look and, like, weigh those pros and cons and say, okay, what does it look like if Ballad stays Ballad, but we make these changes, and we have different oversight, and we have different stipulations? Because now, so Terry, here's the things that I would say, right? Here's what I would say to you guys. Write down your concerns about labor monopoly, because I know what my concerns would be, and I know what my concerns would be in terms of medical monopoly, right? So what I would say is, hey, let's poll. Number one, I'd let you guys have a union. In addition to that, then, you know, what are the things that you would want written into the COPA to protect the employment? Because there are things in this COPA around employment, guys. There's certain rules about, you know, who they can fire and can they fire people without cause within the first 2 years of the COPA. Like, there's stuff that's in there. I would say to you, if you've lost your job and you feel like it wasn't for a valid reason, and it was after this COPA, then I would absolutely tell you, look at the terms of certification under the employment section and look at those things, because you may have a case. Okay. So again, so this is what we look at. If is the goal to terminate the COPA, or is it to modify the COPA so that the hospitals can function? Here's what I feel is being done right now. I feel like the very minimum is being done to meet the COPA, the terms of the certification. So for example, the terms of the certification said that they would not close any hospitals within 5 years. So they're not, but what are they doing? They're stripping them down to like a skeleton crew, or they are repurposing them for different things. And as long as it's clinical and medical in some form or another, then technically they're still in compliance with the COPA, right? Well, I don't want somebody who's going to technically be in compliance with the COPA. I want someone who's going to do it in good faith, and good faith with good actions and with good intentions for the well-being of the community. And I think that that's the difference. You know what I mean? The same way I don't want a husband who's just married to me but cheats on me. You know what I mean? Or a guy who says, well, I didn't sleep with her, but we just sexted and we just talked on the phone and we just blew each other kisses. You know, I don't want you to be slicing hairs with me. I want you to be fully committed. You know, and that's what we don't have. That's one of the things that I remember from one of the FTC's testimonies is she made the statement, and she said the hospitals, like they're only required to keep them open. But this is what I'm saying, guys. I know that it's an at-will state, but listen, Ballad has a COPA in terms of certification that are different when it comes to employment. Would the initial sort of need for remain in effect for Holston Valley? I don't know what you mean. Would it when? Because I don't know. But Sheila, there's not a lot of places for medical. Well, number one, folks, listen, we've lost a lot of medical staff now. The hospitals are short staffed. That's part of the problem that we have right now. Nurses are already leaving. We have nurses right now that are being pulled to different places to work different areas that they're not supposed to, that they're not used to, that they're not trained for, that they're not certified for. There's a lot of stuff happening right now because either people are leaving, or people have been let go, or people don't like the restructuring and the realigning, or people don't want to have to choose between, you know, doing the right things by their patients and keeping their job. Like there's a lot of stuff that's happening right now. So those are a lot of the things that you want to take into consideration. Lee County, like for example, we went to Lee County tonight, and I knew that they didn't have a hospital. What I didn't realize was they don't have anything. Like, like they don't have anything. No, I'm aware everything. I know I'm aware that everything is short-staffed. I'm aware. But you know, and I started to think about this because listen, when we drove to Lee County tonight, there was no bad weather. There was no construction. There was no bad traffic. It was a straight drive. It was, you know, cut and dry. And it still took us around 50 to 55 minutes to get there. So on their best day, in their best case scenario, it's an hour from them to Holston Valley. I mean, that's their golden hour right off the top. And I really had to sit back and think about this. So like one of the things that I believe should be a part of this process is what can we do and what needs to be done for Southwest Virginia? Something has to be done, you know, some sort of, you know, at least a level 2 NICU somewhere, and at least a level 2 trauma center. That's my thought process, you know, something in Southwest Virginia, because when I look at things like Buchanan County, their infant mortality rate is over 19. 19 out of 1,000 babies in Buchanan County die right now. 13 out of 1,000 babies die in Lee. 15.2 babies die out of every 1,000 in Bristol, Virginia. There's a lot of stuff that plays into that, folks, right? But there are things that we want to be talking about, right? Those are the things that are on the plate, and we have to figure out how to do this. How do we do this in a way that makes sense so that people have access to health care and that businesses don't go under trying to provide it. Right? We have to figure out how to do those two things. Now, one of the ways that I think you do those two things is you find a CEO who doesn't need $1.4 million to live. You find somebody whose heart is truly part of the process and whose heart is healthcare for the promotion and the protection of the people. And that's who you bring in to run your hospital, right? Not somebody who looks at it just at the bottom line and says, hey, if you want me to come in and do this thing, I need to hobnob and rub elbows with every politician in town, and I need $1.4 million to do it. To me, that's not the person that you need to run your hospital, right? And here's the other thing. Now, so Lee County is a little unique. So they had to take tonight. It was a little it was different because Lee County had to take a recess because the board needed to go to a viewing for a member of the community who had passed away. So they do have the resolutions. They will be voting on them. They already passed one resolution back in September opposing it. So I expect them to do the same with these other resolutions. But they did have to take a recess to go to a viewing for someone who passed away. That was 45 minutes. So we ended up leaving, but we did get a chance to speak. I did give them my packet of information, and they did actually ask me to write down all my contact information so that they could contact me with additional questions and things like that. So, I wanted them to be informed. I think their situation, like I said, is a little bit different because they don't even have anyone there. Yeah, so I heard about AmeriCorps a little bit tonight, Candace. So those are the things that I really want you all to start to think about. If you're an employee of Ballad Health, I would say to you, be thinking about what you want life to look like as Ballad and as separate hospitals, because if they become separate hospitals again, we don't know what that looks like, and we don't know who else might buy them. We don't know what else might be done. What are the things that need to be done? And what I would say is that if you want to say in that, a union seems like a pretty good way to make sure that that happens at some point in time, So, just throwing that out there for you guys. So, like I said, I do think that Lee County is gonna do their resolutions to oppose because they already did the one in September. Hawkins County floored me last night with the way that they showed up for themselves. There's a lot of other things. I have some other things that have come to my attention that I want to talk about, but before I talk about them, I have to do a little bit more research because I've been given information that is significant, that is important, but I need to dig a little bit deeper. I need to make sure that I have all the facts, and I need to make sure that I understand what the implications are going to be for everyone before I just spew them out. Okay, so just stay tuned and give me probably until Thursday or so to do a little bit more digging, and then I'll be able to share some more information with you. Okay, so so I do want to tell you this: the rally is happening. The rally is going to be December 29th at the farmers market in the indoor piece of it in Kingsport. It is going to be December 29th at 4:30 p.m. They are putting the agenda together. I do know that I will be there speaking. I believe Dr. Spivey is going to be there speaking, and some other people as well. I'd be happy to, Terry. Of course, you know the answer to that. Absolutely. You are more than welcome, Keith. So, I want us to be grown-ups about this and start to understand that this isn't a case of us twinkling our noses and everything go back to the way it was. I've heard some of you all say, I want my Wellmont back, or I want my Holston Valley back before Wellmont ever bought them. Folks, you can't have what you had in the past. I don't care what it is. You're never going to be the same way you were in high school, and your hospital's never going to be the same way that it was when it was built. Because as things happen and we experience life in different ways, it changes, right? It changes who we are, it changes what we have, it changes life. So you need to be thinking about, what do you want to create for the future? Not what you had in the past. What do you want to create in the future? That's the important piece of it, right? One of the things that I found really, really interesting in listening to Alan Levine talk And this is something I would love for someone to ask him, because he's never going to talk to me. But here's one thing that I would love for someone to ask Alan Levine. He talks about this ridiculous competition that the hospitals had previously. And he talks about all these missed opportunities and duplicated services. And he talks about people being transported from Indian Path or one hospital all the way to another one, and they skipped over another hospital unnecessarily because it was competition. Well, here's my thing. You were the CEO of one of those hospitals, so why didn't you change it then? If you didn't want MISHA patients being flown from MISHA to MISHA, if you wanted what was in the best interest of those patients back then, why didn't you step up at that time? You were the CEO. You could have changed that. You and Bart Hove managed to agree on a merger of your hospitals. You're telling me that you all couldn't agree how to manage your hospitals in a way that would benefit your communities without a merger? Because that's what the FTC asked. They said, listen, a lot of the benefits that you want to do, you could do if you'd just be willing to work together. So I don't know, is that possible? Can Ballad be undone and the people who run those two hospitals have healthy competition that's not at the risk of the patients? Can that happen maybe? So those are some of the things that I really want you to be thinking about. One of the things that we're going to have to stop doing, and this might not be what everybody likes to hear, but everybody who's running down and who's nitpicking. So for example, I'm not going to, like last night, I knew Andy Hall was there, and that's it. Like, I don't care what he's doing. I don't care who he's texting. I don't care what face he's making. I don't care if his foot is shaking, because it's not pertinent to what we're trying to accomplish. You know what I mean? Like at some point we have to figure out how to fix this thing together. Now that doesn't mean I'm going to take your shit. It doesn't mean I'm going to let your stuff, I'm not going to let stuff go. I'm not going to, just lay down. What it means is at some point we have to say, okay, what does this conversation look like? One of the things that I think that the state of Tennessee, the health department, the review of the COPA, I believe should be done here. I believe that the review of the COPA should be done in Kingsport because it's the central location for the entire geographic service region. I don't believe that it should be done in Nashville, where it's an expense for people here who attend to have to get there, right? I believe the state should come to us. Why should 1.2 million people try to figure out how can they get to Nashville and worry about gas and hotel rooms just to try to save their health care and be heard, when 3 or 4 people from Nashville could pick up and come to Kingsport? So maybe that's something that you all could do. Maybe that's something that you all could email the state and email the Attorney General and say, hey, Judy Kinnick, hey, Commissioner Dreisner, hey, Janet Kleinfelter, hey, Jeff Ackerman, can the 4 of you guys get on a plane and come to us? Let the state pick up the bill for the mess that you guys helped create, and come here and make Ballad Health be accountable, make them show us the details of their plans, because they really haven't shown them yet. You've even said you don't think they have them. Hear the voice of the people, hear the concerns of the patients, hear the stories. I don't know if you guys saw it or not, but the lady who told her story last night, I had actually received an email about her situation and what happened a while ago. But the thing is, I can't just tell people stories. I have to have documentation. And I never got documentation from her. So when she showed up last night, I was so excited that she was able to stand up in Hawkins County and tell her story. It was after midnight. They called EMS. They thought she was having a stroke. She's deaf. So when they told her that they thought she was having a stroke and they were going to transport her they were going to fly her to Johnson City, she called her friend to meet her there because she needed an interpreter. Her friend beat her from Rogersville to Johnson City. crazy. It took them like an hour and something to get her from Rogersville to Johnson City. Her golden hour would have passed. Even if she was having a stroke, holy gee, she would have been in trouble. And because they bypassed Holston Valley, which was the closest level 1 and the closest like stroke center or whatever it used to be, her insurance is saying they're not going to pay for the flight. And she got a bill for $44,000. Tennessee State Health Department, Commissioner Drosner, Attorney General, you guys come here and listen to her. Let her tell you her story face to face. Come talk to the mamas. Come talk to folks who are here in this community, and don't make it our expense. Don't make it any harder on the people who live here to express themselves and to fight for their health care. You guys come here, you know, it's the least you guys could do, because after all, you're the one who approved this freaking merger. So maybe that's an email that you guys can send. That's a phone call that you can make and encourage them to come here. Okay. Right, Kathy. Well, in this case, that's what I mean. So up until Ballad Health started moving equipment from Holston Valley, they did have the distinction as being the appropriate stroke facility for her to be taken to. And my understanding is that those things were still there when this happened, when this occurred. Right. I don't mean closest as in just geographical. I mean appropriate. Right. And like for right now, Holston Valley is still a level 1 trauma center. And so is Johnson City. So there's no reason that they shouldn't be going there unless there's a specialty, or in this case, unless Ballad Health has already removed equipment, which we know that they have in some cases. So I said all that to say this: if you're an employee, start to kind of look at what you want things to look like. If you're not an employee, and if you are, you know, a resident here and a citizen and a constituent, I need you to start to think about, what does healthcare look like, and understand that you're in for a long haul and you need to stay motivated, right? We've had some good wins. We've had some good progress. They actually notified Allendale today that their date to move, which was supposed to be January 21st, has been moved now. And it's delayed until at least March 4th. So I'm hoping that we can get it delayed again after that. So we've gotten some good pauses, right? We might not have like stopped everything and, you know, whatever, but here's what we've done is we've slowed things down. We've put some pauses in the road and said, hold on for a second. You're not just going to, you know, run all over everyone. You know, we're going to pump the brakes for a second and see what we can make happen here. So I want you all to be thinking about those things. I am very, very grateful to all of you all for sharing the lives, for having conversations, for emailing, for picking up the phone and calling. You know, I get that you guys are grateful that I'm here and that I'm able to be your voice, and I'm honored to do that. I need you all to understand, though, that the fact that you all have been willing to show up for yourselves is what's made the difference. I could be here talking my head off and it wouldn't matter if you all weren't doing your part, and that's important. Brenda, honey, you must have just hopped on here. I talked about Hawkins County already. But it was great. It was a great meeting. But I talked about Hawkins County at the very beginning of this live. So here's what I want you all to do. Start to think about your healthcare in your community. Now, let me just say this, and this part is going to be the part that might not feel so good, right? This part might not feel so good to you. But here's the other thing. I want you all to also start taking accountability for your own health. Yes, you deserve access to health care, right? You deserve immediate, easy, quality health care. Everyone does, right? And we also have to start looking at our own choices and our own lifestyles and the things that we do that make us reliant on these hospitals and this health care. And I don't expect for you guys to throw up about 10 hearts for that, but I'm just saying that's part of our responsibility as well, right? So, you know, our government, our state, our healthcare systems, you know, they have commitments and they have responsibilities to us. We also have responsibilities to ourselves to take care of the vessels that we live in that God gave us for this lifetime, you know? So I'm just going to say, I know that there are things that we're known for. The South, I joke about when I come home because everything's either going to have some gravy or a damn biscuit to go with it. Everything. And everything is going to be a big portion that's enough for me, you, and my next door neighbor. At the same time, right? We have to start being accountable. Just because it tastes good don't mean it's good for you. When I talked to John Metz the other night on the phone, I said, listen, I'm from here. And this is what I always say about being here. Everything is fried, right? But this is what I say about being here. Here's what we have. We have a bunch of restaurants with a bunch of food that tastes good that's bad for you, right? Then we have a bunch of hospitals and doctors to take care of us when that good food that's bad for us makes us ill. And then we have a church on every corner to pray for us that's full of people to cook us more of that good tasting food that's bad for us when we're too sick to cook for ourselves. And that is what it is living in the South. Right? Where we're from and how we live, that's what it is, right? You got restaurants, churches, and hospitals. And we have to fix that. We have to fix that. Now, here's what we also know, right? Places where you have higher rates of poverty, you also have higher rates of people who are unhealthy. So how do we fix that? What do we do about that? Okay, what are some things that we could do about that? Well, I would love to see us get back to our real country roots, right? And I would love to see us have community gardens. Y'all laughing at me. I'm just telling the truth. Y'all know that's how we do. Right? But I would love to see us have, community gardens. I would love to see us have good prenatal care where people actually went to their prenatal appointments and lower our premature birth rate. Let's start to get educated about what we put in our bodies. And, you can still have food that tastes really, really good, that doesn't clog your arteries, you know what I mean, and make your heart choke. We can figure out how to do a little bit of that. You don't have to give up everything, but, things in moderation, just not every damn day, So I'm just saying that's some other parts because, they gave money. So part of the money that they committed in this COPA was for patient education. It was for population health. So what does that look like? What's some good stuff that we could use? What are some bike trails that we could do? What could we do, with all of that stuff? With all of that money, what are some healthy things that we could do? They've talked about the fact that we have an aging population here. Well, guess what? Here's what I know. People that are 40 to 70, that's the fastest growing age of people who are looking to get fit and healthy. Right? So how could we do that? How could we build centers and use some of that money that's available for that generation? You want to stop them from having falls, help them build muscles, help them be stronger, help them be healthier. That's how you do that. And you can still turn a profit, So those are just some things running through my head. Start to think about what you want to create. What does this region want to look like when we're all said and done with this thing? I think that's a worthwhile thought to have, So anyway, like I said, I've got a couple of big things, but I'm not going to talk about them tonight because I need to do a little bit more research on them. And Hawkins County, again, you gave me some good, yummy goodness. You're welcome, Linda. So I'm just saying. Okay, so listen. I'm going to research these other two things because there are some things that I'm really concerned about. There are things that I've heard about hospice. There are some things that I've heard about the yes, I agree, Mike DeVoe. I agree. Injury prevention is huge. I agree. Absolutely. Those are some of the things that I think would be amazing for us to be able to incorporate, I think that for the longest time, hospitals have been post-problem driven. Well, what if we could post-problem capable, right? We want to be able to fix the problems once they're there, because we know that we're going to reap what we've sown up until this point, right? But what if we could be preventative? What if we could be, protective of our health? And what if we could promote good health in a way that works for people? Helping people find what's the lifestyle that works for you. So we're not this is not a young booming area. I get that. Nobody's asking this region to become Charlotte or Atlanta. What we are saying is, what does healthcare look like for our region? What does it look like? And how could hospitals and healthcare do it in a way that is profitable, right? But not at the expense of the people. And I think that those are the conversations that really need to be had. And I think we can have that. I really do. So hopefully, I know that this, I didn't give you anything breaking news tonight, but I wanted to recap Hawkins County because it was huge. I wanted to tell you a little bit about Lee County. Lee County really got my wheels turning. Southwest Virginia has really got my wheels turning. Between the opioid problem that exists in this region, the babies that are born drug exposed in this region, and the geographic challenges that we have in this region, it's really got me thinking about unconventional ways that we could, bring about some positive changes in this area. And with that, what does Ballad Health look like with a COPA, with modifications? And what does Wellmont and Misha look like separate again, maybe working together or maybe being purchased? Those are things people really need to consider, okay? So I'm gonna get off of here. As y'all can hear, I got a little bit of a cough. I'm tired and got a lot still to do in the next little bit. So I'm gonna get off of here. Should be live tomorrow night at 9 o'clock regular time. Make sure people see this one too, because I know it was at a late hour, so people know it happened. And continue to contact your representatives, your state health departments, the Attorney General. Stay on those things. And remember, make them come to us. Make them come to us instead of us trying to figure out how to get there, so that we can have a real conversation and a real review of this COPA. Okay? Yeah, Crystal, me too. All right, I'm going to get out of here. Be amazing. Be light. Be love. Peace. What are you watching, Mama?